Good afternoon. Welcome to today's presentation. We are going to look at surgical conditions of the biliary and the urinary system. We'll look at the surgical conditions of the biliary system. In this unit, you will get an opportunity to study the common surgical conditions affecting the appendicular organs of the digestive system and the urinary system. You'll also be able to know how to care patients with these conditions, especially those who have undergone surgical procedures. So one of the objectives for this unit is to ensure that you are able to explain the management of a client with disorders of the liver. You should be also to describe the management of a client with disorders of the gallbladder. Apart from that, you should be able to explain the management of a client with disorders of the spleen. As well as describe the management of a client with disorders of the pancreas, explain the management of client with disorders of the urinary system. So in our today's discussion, we focus on the liver. So we'll look at the disorders of the liver. So the liver is an intra-abdominal accessory organ of the digestive system. It normally weighs about 1.5 kg. However, when it is diseased, it can weigh up to 10 kgs. So if you look back, you get back to anatomy and physiology, you realize that the liver is one of the organs which were taught under accessory organs of the digestive system. In a normal circumstance, the liver weighs about 1.4, 1.5 kgs. But in a situation where it is diseased, its weight may increase as far as up to 10 kgs. Let us look at the functions of the liver. The liver plays a number of functions, but among them includes metabolism and energy production. Metabolism and energy production, like we know that the liver is it becomes a source of energy in situations where individuals are starving themselves. So the liver has to undergo gluconeogenesis to produce energy for the tissues which are being starved. Bile production. The liver also functions to produce bile. When bile has been produced by the liver, it is stored by the gallbladder. So it is very important that we know that the bile that is being stored by the gallbladder is being produced by the liver, not that it is being produced by the gallbladder. The gallbladder is just a reservoir where it's being stored. The liver also plays an important role in the storage of iron, vitamins, and trace minerals. It also plays an important role in the detoxification, conversions of waste products for excretion by the kidneys. All these are some of the roles that the liver plays. So we have the diagram of the biliary tree, which you can see that on top here, we have the liver, and you can see that we have the hepatic ducts. The hepatic ducts. We have the gallbladder. Of the gallbladder, we have the cystic duct. This is the cystic duct. Then we have the common bile duct. The common bile duct, and this is left hepatic duct and right hepatic duct. You can see that there are two here. They are coming together to join and form the common bile duct. Then this cone-shaped curved structure here. This is the stomach. This is the stomach, and we also have the pancreas here. We have the pancreatic duct, the small intestines. We have the duodenum here, then floor of the bowel, as you can see from the diagram. Conditions to be discussed under this unit of liver abscess, polycystic liver disease, liver cirrhosis, neoplastic cyst, hydrated cyst, portal hypertension, esophageal variceal hemorrhage, hepatic stroke, or liver tumors. So these conditions will be discussed so that we are able to be equipped with knowledge and be able to manage these patients with various conditions. So our first condition that we're going to look at today is the liver abscess. The liver abscess is a pus-filled mass inside the liver. We're saying it's pus which is found in the liver. The one that is called liver abscess. So it is just like any other pus that you can find on any other organ of the body, but in this case, here is pus that has been found in the liver. So it is called liver abscess. So a liver abscess is a pus-filled mass inside the liver. So this pus is inside the liver. Let us look at causes. The common causes are abdominal infections such as appendicitis or diverticulitis due to hematogenous spread through the portal vein. The common causes of this liver abscess are saying infections of the abdomen which spread through blood by using the portal vein. So this infection can be due to inflammation of the appendix, what we call appendicitis. There are three major forms of liver abscesses which are classified by etiology. So despite that we have discussed or we've defined a liver abscess as a pus-filled mass inside the liver, but this can be also classified into three ways depending on the cause or what we're saying etiology. So the first one is pyogenic liver abscess, which is the most common polymicrobial hepatic abscess. So in pyogenic liver abscess, which is the most common polymicrobial hepatic abscess, it's a type of an abscess which is found in the liver due to overwhelming microorganisms. So when microorganisms are overwhelmed, they cause pus, and this pus, which they co-affecting the liver, we get to formulate this name known as the pyogenic liver abscess. Pyogenic liver abscess. The pyogenic is coming from the word microorganisms. Microorganisms as a result of infections, as a result of infection which is coming from the pus. Then another classification by etiology is amoebic liver abscess due to Entamoeba histolytica. So you can see that this is being caused by another condition that we normally discuss it under diarrheal diseases of the GIT, which is caused by Entamoeba histolytica. So when this is the one that is responsible for the presence of pus in the liver, we call it amoebic liver abscess because it has been caused by Entamoeba histolytica. Then the other cause, according to etiology, is fungal abscess, due to fungal abscess, most often due to Candida species. So this is a type of abscess that is caused by fungal infection, e.g. in Candida species. Let us look at the predisposing factors that can make someone to have liver abscess. 1. Inflammatory bowel diseases, particularly Crohn's disease, due to loss of integrity of mucosa barrier. So when the mucosa barrier has been lost, you find that the mucosa membrane will be predisposed to inflammatory condition, which will eventually infect the GIT, which you are describing as digestive tract. Then infection will spread from there through the portal vein and reach the liver. Then we also have liver cirrhosis. In liver cirrhosis, this is chronic inflammation of the liver, predisposing someone to have damage of the Kupffer cells, eventually having pus of the liver. Like we said, in the liver abscess, the destroyed cells of the liver, they get filled up with the pus. They get filled up with pus. Another predisposing factor is hepatic artery immobilization in hepatocellular carcinomas. So I'm saying people with carcinomas of the liver are also at high risk of developing liver abscess, because these cells, they get damaged by the cancer cells. The cells of the liver, they get damaged by the cancer cells, hence damaging their cells, which will be filled up with pus. Also in immunocompromised individuals. Like we said, like we mentioned on the functions of the liver, where we said one of the functions of the liver is the process of detoxification. So in immunocompromised individuals, the liver loses its capacity, its role of detoxifying. So when poisonous substances reaches the liver, instead of the liver getting rid of poisonous substances, they tend to damage the liver cells. Eventually, the cells which have been damaged, they start making pus within the tissue of the liver. Then the 60th predisposing factor is older age associated with it, biliary sepsis, also malnutrition, malignance, pregnancy, steroid use, and excessive alcohol, which has been well linked to development of liver cirrhosis. Another predisposing factor is intake. Intake predisposes to liver abscess formation. Excessive intake of alcohol predisposes to liver abscess formation. So taking alcohol for a long period of time, like 3 to 4 decades, excessively, abusingly, it may predispose someone to liver abscess, may predispose someone to formation of the liver abscess, because the Kupffer cells of the liver, they get damaged. The cells which have been damaged, they create holes where pus will start to form within the liver. Let us look at the mode of spread of infection. Let us look at mode of spread of infection. The disease spreads through the lymphatic system. The disease spreads through the lymphatic system. Intestinal infection can reach the liver through the lymphatic vessels. We are saying intestinal infection can reach the liver through the lymphatic system. So by lymphatic system, we're saying when someone has an infection of the intestine, the infection will be able to reach the liver through the lymphatic channel, So when the lymphatic channel or when the lymph vessels reaches the liver, they'll be able to damage the liver cells or the Kupffer cells, and the damaged cells will create holes inside the liver where pus will start to accumulate or start to form. The second method of spread of infection is bloodstream or hematogenous spread. Infection is able to reach the liver by means of blood. So infection can be carried from elsewhere in the body, and through blood circulation, the infection will be able to reach the liver and destroy the Kupffer cells, where some pus will start to form in the cavities that have been made. The third mode of spread of infection is direct contact. The third mode of spread of infection is direct contact. Under direct contact, through a penetrating of blood wound and infection in the adjacent structures such as the gallbladder. So we are talking of infection which is closer or adjacent to the liver. Infection can easily spread or can easily move to the liver and infect, destroy, damage the Kupffer cells of the liver, make some cavities where pus will start to accumulate. Let us look at the pathophysiology. What normally happens when someone has liver abscess? Cells die and disintegrate, leaving spaces or cavities. Like I was explaining in my previous slide, say when cells die, the area where they've died, they normally leave a space which we are describing as a cavity, where fluid and infected cells accumulate. So the very cavity that we're explaining, we're saying fluid and infected cells will accumulate. White blood cells engulf the bacteria and it dies. So the presence of white blood cells, they're going to engulf the infected cells which they are there. So the infected cells, when they've been engulfed, they die, they remain there forming pus. The dead white blood cells accumulate as a cream substance, pus, filling the whole area. These cells eventually grow around the abscess wall and they grow around the abscess. They grow around the abscess. So just like I've said, cells die in the liver. So when the cells dies in the liver, they leave a space. So that space that has been left, the fluids and infected cells will come and accumulate in that space. Then the white blood cells will come and engulf. The engulfing of those cells, they'll be killed. So when they've been killed, they are going to remain on the same cavity, which with time they are going to form a cream substance, which we describe it as a pus. Let us look at signs and symptoms. The main signs and symptoms include nausea and vomiting. When someone has liver abscess, they will present with nausea and vomiting due to GIT involvement. Then loss of appetite due to GIT involvement as well. There is fever due to presence of infection. There is abdominal pain due to inflammatory condition coming from the liver coming from the liver with the presence of infection. Then particularly in the right upper part of the abdomen. So when we talk of abdominal pain, which will be quite evident in the abdomen, but to be specific, on the upper right quadrant where we find the liver. Then intense, it is intense, continuous or stabbing pain. So the manner in which this pain presents with it is always continuous. The pain is continuous and it presents a stabbing pain, like someone has been stabbed by a knife or any sharp object. Then chills will be there. Diarrhea in only 1/3 of patients. So diarrhea may be present, but in most cases there is no diarrhea. Then general discomfort and easiness or ill feeling, what we describe as the general malaise because of the illness. Then jaundice, joint pain, sweating, and the weight loss, because here an individual has no appetite, So definitely not eating for a long period of time, they'll be predisposed to loss of weight. They'll be predisposed to loss of weight. So having known that someone has presented with various signs and symptoms of liver abscess, how are we going to diagnose? So it is very important that we do what we call computed tomography, ultrasound scanning to detect liver abscess, to detect pus in the liver. We can also do what we call complete blood count, or what we call full blood count, to know the HB as well as the presence of raised WBCs, presence of raised white blood cells. Liver abscess aspiration to check for bacterial infection in the liver abscess. So we can also do what we call liver aspiration, liver abscess aspiration. So first of all, you need to look at the ultrasound scan or the X-ray. Then you get your green needle with a syringe, anatomically with your physiology. You need to focus where the pus has been isolated, and you try to aspirate. Then you send the pus to the laboratory for for studies. Then liver function tests can also be done. Liver cell function tests can also be done. Serology for amyloidosis, which we said it is one of the etiologies that can be there. So in liver function tests, there are a lot of things that they can come on. It can also bring to us amyloidosis, can also bring to us about the presence of fungal. If the liver abscess is due to fungal, like we said in the etiology, that there are about 3 things that can bring about abscess in the liver, that is biogenic through past accumulation of microorganisms due to an infection. We also talked of fungal or amyloidosis through Entamoeba histolytica. We can also do stool testing for amyloidosis, stool testing for amyloidosis. How do we manage liver abscess? So let us look at the management of liver abscess. The management involves the abscess aspiration, a surgical procedure used to drain the pus. So the pus that we are discussing, the pus that has been identified, isolated through various investigations, ultrasound scan, CT scanning, this pus has to be aspirated or has to be drained surgically. Also, administration of systemic antibiotics. Administration of systemic antibiotics to get rid of infection is one of the management. Contraindications for liver abscess aspiration. Despite that we've mentioned, say, aspiration of the abscess is one of the management, however, there are contraindications when you are not supposed to do abscess aspiration. So liver abscess aspiration should not be done if the following conditions are suspected. If the following conditions are suspected. 1, hydrated cysts. Aspiration may lead to anaphylactic shock. So in hydrated cysts, aspiration is not allowed because the patient may go into anaphylactic shock. The second contraindication is hemangioma. Hemangioma. In hemangioma, if you try to aspirate, it may result in internal hemorrhage leading to shock. So in hemangioma, you don't need to aspirate. When you try to aspirate, the patient will keep on breathing, and the breathing that will be there will be, it will lead to shock. And this type of breathing is what we describe as the concealed bleeding or internal breathing, the breathing that you can't see with your eyes. Another contraindication is liver aspiration should be avoided in patients with breathing disorders. Aspiration should be avoided in patients with breathing disorders. In this one, we talking of patients who lack vitamin K, phentermine. So if we know that patients they lack vitamin K, which may predispose them to bleeding disorders, aspiration has to be avoided. Let us look at the preoperative care that you can give to a patient with a liver abscess. So the general preoperative nursing management includes carrying out the investigative we mentioned above. You need to carry out the investigative procedures which we mentioned in our discussion earlier on. Apart from that, giving vitamin K if there is jaundice or raised prothrombin time. Someone is breathing, but breathing cannot be controlled, meaning there is raised prothrombin time. It is taking time for blood to clot, and that simply signifies that there is low levels of vitamin K. Therefore, we need to administer vitamin K. General post-operative care you can give to the patient includes care of psychological care to the patients, psychological care of to the patients. You can also you also need to care for the drain that has been inserted to drain the pus. Care of the drain that has been inserted to drain the pus. Information, education, and communication has to be given to the patient, especially to emphasize on the need to stop drinking alcohol so that we can give chance or time for the liver to heal. Also care of the drainage tubes and the incision sites so that we prevent infection at all costs. Complications, the two main complications are secondary hemorrhage, the two main complications which can be associated with liver abscess after surgery, secondary hemorrhage. Then another complication is secondary bacterial infection, disintegration of lining wall of the cavity. So those were the two complications which can come due to surgery after liver abscess. Of course, you can also bring in other complications which are always associated with the surgery. But in as far as liver abscess is concerned, when someone undergoes a surgical procedure, the main two complications that we expect to hear from the student will be secondary hemorrhage as well as secondary bacterial infections. Unless we have questions, otherwise, for today's discussions on liver abscess, we've come to the end. I thank you so much for paying attention. Thank you.